Welcome to another episode of the Dental Insiders with your hosts, Matthew Petchel and Michael Dunn. The Dental Insiders is a podcast for dentists, dental team members, and industry professionals. We'll share stories and lessons from clinicians and industry visionaries with the goal of providing an entertaining and informative look at the industry we share. And our guest today is none other than Dr. Lee Ann Brady. Woo! Dr. Brady, thank you so much for joining us.
Oh, no, thank you for having me. I think this is going to be fun. I can already tell.
It's going to be fun. We're excited to have you with us, and let's jump into it.
Let's jump right into it. How did you, so you've worked all around. You've been a dentist for how long?
Oh, you're going to start with the hard question.
Yeah, let's go with the hard.
28 and a half years. So at least you didn't ask me my actual chronologic age.
No, come on. I'm smarter than that.
You're a pro. You wouldn't.
I know I don't look real smart, but I know that's not a good question. So
you're great at accents too.
Right. It was kind of like Southern Irish mixed together.
It was something.
So, okay, 28 and a half years. Something must have happened in that half a year that's very important.
Yes.
Because you're going to put that in.
Just for accuracy's sake, because graduations are in May, so we want to make sure we're accurate.
Good. So how many of those years have you been an educator, let's call it?
So I've been in full-time dental education since January of 2005.
Okay. So
almost 11 years. Yeah, almost
11 years. So what made you decide to get into that side of it? The dentistry, I'm sure there's a dentistry story too, how you got into dentistry, but how did you get into the education side of dentistry?
It's actually, the funny part about that is I actually didn't decide. It sort of just chose me instead of me saying, oh, I really want to teach. I was actually down at the Pankey Institute taking courses there as a student. And something I said or did or whatever, we've never gotten the exact details, happened to catch Steve Ratcliffe's eye at the time that they were looking to bring on a third faculty member. And so they actually approached me in September of 2004 and asked me if I'd be willing to leave my practice, which was in Jacksonville, Florida, and come down to the Institute and join them full time as a faculty member.
And and the rest is history.
The rest is history.
And the truth is, yeah, the rest is history.
So they just said, you know what, we need a pretty girl, and we were two regular looking guys. We need Lee Ann Brady.
Yeah.
And she's smart, and she's good at what she does, and
the pretty part.
the full package. The full package.
No.
Okay, cool. And how did you get started in dentistry? So let's go backwards from there. So 11 years ago, you went the education route. But how'd you get into it? So you started in Jacksonville. Did you grow up there?
Actually, I grew up in Fort Lauderdale in South Florida. And you'd think it was logical that I'd go into dentistry because my father was a ceramist. So he owned a Crown and Bridger ceramics laboratory for 40 years. But I was actually on a path to head to medical school, which isn't that uncommon since you guys interview dentists. And after spending some time at Shands Hospital, which is in Gainesville, Florida, because I went to UF, and just sort of seeing what the lifestyle was like of people who were there who were medical students, I just literally was like, yeah, I don't think I want to do that. So decided to go to dental school because I did have that exposure. I'd been a dental assistant on summers through high school and worked in my dad's lab. So off I went to dental school. And, now all these years, here looking backwards is like, darn, that was a smart decision based on all the things that have happened in medicine.
Right.
But at the time it was just kind of honestly avoiding really hard work because I wasn't too into working at 3 a.m. So.
Right.
Yeah.
Which is still, we find a lot of people that we talk to have a different way to get there. But once they get there, it's like,
what a good decision.
Right. It's almost like, I guess it's just, if you believe in the path has kind of almost been chosen for you, you just have to listen to the trees maybe,
yes,
or listen to the wind. What do you listen to?
Listen to that voice deep within.
The deep within voice. Got it. Okay.
Something like that. So 11 years or so ago, you started your path in professional education, and obviously to say that you are a well-known educator is quite the understatement. And of course, practicing dentist as well. So talk to us a little bit about the importance of, I'll call it, lifelong learning for dentists.
Yeah, actually, that's one of the things for me that I'm super passionate about because honestly, it's what made the difference for me. And the years where I actually hated practicing dentistry, I actually quit practicing dentistry in 1999 and actually stayed home for a couple of years with my kids when they were little, and went back in serendipitously, not by choice, but because my husband lost his job. And when I went back into dentistry, happened to be in a practice where the senior dentist was a lifelong learner. And he was committed to continuing education, and realized for me really quickly that that was the linchpin for me really loving it, staying engaged, always being able to do new things, and also have a way to be around other dentists. So I think there's two pieces of that. Dentistry can get pretty rote. After a while, a DO is a DO is a DO. So, in order to stay engaged and really loving what you do, I think for most of us, we really have to be learning new things or having different ways of looking at it. And most of us practice on our own. We're sort of isolated, and that can be challenging. So one of the things that CE grants us is the ability to sit in a room with 12 other dentists who are pretty typically like-minded. If they chose the same CE course, they're looking for the same learning or the same type of learning, and actually get to either share our joys and our passions about dentistry, and actually sit and say, oh my God, I did the coolest veneer case, without people looking at you like, that's odd that you're so excited about that.
Right.
And on the other side of it, get to say, oh my God, I can't believe I couldn't get this to work, without people also thinking, come on, you're a dentist. You got life so easy. What is it you're whining about? So I think it's the both end of the community and of the information that for me makes learning the key. And part of that is to do my own learning, but also to be able to give that back to other people. And I love being around other dentists and watching them find that spark that turns it into something they're like, okay, this is the key for me loving dentistry for the rest of my career.
Right. It's interesting that the topic of, I'm going to editorialize here for a moment, but it's interesting that the topic of community came up in that answer, because we talked to a lot of people, obviously, and this, one of the themes that seems to emerge, whether we prompted or not,
right,
is that theme of community.
Yeah.
I think that's interesting.
It is. It's always in there. And I think, like we talked about, it's people want to connect with like-minded people. It makes it easier. It makes it, you feel like you're not alone, right? It sort of takes that off the table and maybe gives you a more uplifting outlook.
I was going to sing "You're Not Alone."
I did uplifting outlook.
You did. How I went, yeah.
So here's this really simple one. Can a dentist these days survive without some lifelong learning strategy?
I guess the answer is technically yes, they can. There are still a lot of dentists out there who, honestly, the only learning they do are the credits they need to keep their license up. And we actually still have one state in the union where there's no CE requirement for dentists. So I guess the dentists in that state can do no learning of any kind. And I think that's probably true of every profession. It's a bell curve of people. I think that most dentists do some form of learning or education, whether that's to go learn and do new skills because they're trying to keep their practices productive. So they want to learn how to place implants, or that they want to learn how to do sleep apnea appliances, so they're expanding their business mix.
Right.
Doing education because something's not working. They seek it out as the answer to a frustration for something. And then there are people who just realize somewhere along the way that they just like to learn for the sake of learning. And those are the folks we kind of tease and say are CE junkies. But when you say, hey, what CE have you done? They rattle off the long list of names because they've done it. They've been to all the institutes. They've been to all the places. But in that bell curve, yeah, I think there are dentists who do very little to almost nothing. And I think, you can call the ADA and ask them what the average amount a dentist spends on CE every year is. And it's a really small number. Last time I heard it, I think it was like $900 or something. And it includes travel.
Wow.
Right.
So based on what with the three of us know CE costs,
right,
not much. That's not much.
No, it's not, especially when it's your profession and you hope that you're out there continuing to learn, right? I mean, no matter what.
And it's not like nothing changes within that profession. I mean, there are, and you said earlier, okay, a DO is a DO is a DO, but there are new, like you said, there are new technologies that come about. There are new modalities, new treatments you can add to your practice. And so it's not like it's stagnant, and there's no reason that everything you learned in dental school 10, 20, 30 years ago is going to serve you for the rest of your career. That's kind of a staggering statistic.
We talk about it a lot too, is that we're in a technology boom in the last probably 10 years, right? And you may have, what was the hottest thing 10 years ago that they were teaching in dental school? I mean, it's totally different now, right? Digital was not quite at the forefront, and now everything is going that direction, and the technology helps drive it. It's not the most important part, but it certainly is a big piece of it. So how does somebody find the right lifelong learning partner in dentistry? I know there are a lot out there, but is there an evaluation you can do with yourself? I don't know. How does somebody listen?
So how does someone find the match to the right CE provider? Or
are we a matchmaker right here? Are we trying to how do we help people find the right? Because we're in this. Michael and I have been in this industry 15 years each. We've been in it, and we both have realized we're probably stuck in it, and this is it. You know what I mean?
And we do that to people. Once we get you, we do not let you go in dentistry.
Yeah. So we're in, and we're good with it.
Yeah.
So we support it and want to make it as good as it can be, and that's part of the reason why we do our podcast, is because we think we can share what we know, learn from others, mix it all up, and hopefully somebody can take something out of it and learn from it. So I believe lifelong learning is really important, no matter what you do. Right. To be better, to constantly be better. And so how do we get that 50-year-old who's maybe, and I don't want to stereotype people too bad, but how do we get them to start doing the CE for the right reasons and not just for the low-cost state requirement reasons?
You know what? I think it's like marketing anything, because you're basically trying to help people understand that there's something that CE provider is offering, or that kind of CE is offering, that they maybe didn't even know they wanted, right? And all of a sudden they go, oh my gosh, that sounds phenomenal. And, so for a lot of dentists, it is that they go looking for a specific piece of information. And what they find when they get there is that they got that piece of information, but that's not why they're going to go back. Right. They go back because they go home feeling better about themselves. They go back feeling better about dentistry. That's one of the things that I try to help dentists know when they ask me about CE is, one of the greatest things you're going to get out of it is Monday morning when you go back to your office, you're going to be really pumped and excited about practicing dentistry.
Yep.
And I don't know what that's worth, but in my book, I'd say there's no price tag for that. To be, back in that of, oh my God, I can't wait to do this or that, or see this patient, or, that's the fun part for me, is that energizing piece of it. Where's the right place to go? I think that's as different as every learner is. And, I have had people I've taken CE courses from that are phenomenal clinicians, and I learned a lot of good technical information, and I won't go back because, there was just something about their teaching style that didn't quite connect with the way I learn or the way I approach things. And sometimes there's people that you just gel with. You're just like, you know what? I'll go back and listen to the same course 10 times over, because I just want to go back and be in that environment with that particular clinical educator. So there's so many pieces of that puzzle, but I think part of helping people want it is saying it's not just information. Because the truth of it is you can get information any place now. Information is a dime a dozen.
Right.
It's about all other things.
And that's the way I think it used to be, right? Yep. So I'll make a generalization here, but it used to be 15, 20, 30 years ago. It was just information. There was somebody up the front of the room regurgitating what you could just see on the board, probably on an overhead projector that was melting and fuzzy. And then it was like, this is what it is. Now there's that inspiration part that I think is what is so incredibly valuable.
The inspiration part, the aspiration part.
For sure.
The energizing part that you mentioned, which is worth a whole lot more than $900, I would have to think.
Yep.
So, maybe specifically, you're now involved with clinical mastery. Mm-hmm. And, some people listening to this or watching this might not be familiar with that. So tell us about clinical mastery and, how you got involved and what's new.
Yeah, what kind of drove me to get involved with clinical mastery was, I'm out there obviously on the circuit, as we say, and do lots of lectures for, big groups. And I missed being able to really create personal relationships with the folks who were in the courses and get to watch their learning. You know, one of the things for me when I teach that's so great about it is when I actually know it's having an impact. And that requires having ongoing relationships with these dentists who come to the courses. And so what Clinical Mastery offers is small group education. So it's, 12 to 20 people maximum. And it's a series of courses. So folks come back more than once. So, we build relationships with them. We get to be really involved in their practices and, answer emails after they're in a course and answer questions. And so I missed that piece of it, and that's what Clinical Mastery offers. So I love that. There's 4 of us who teach in all of the programs, myself and John Nasty from New Jersey, Jason Olitsky from Ponte Vedra, Florida, and Mike Smith, who actually practices like 3 miles from me in Glendale, but that's pure coincidence. And so it's also like a really cool student to teacher ratio. There's enough of us around that pretty much everybody can get one-on-one attention and get their questions answered. And our curriculum is a balance of restorative dentistry and occlusion. And really, you said aspirational before, so I'm going to steal your word. It's about not just doing sort of day in, day out operative dentistry. It's about learning to get to do more complex dentistry, whether that's just an anterior veneer case or you want to start doing, more full mouth cases or helping people who really just kind of need their whole oral health kind of rebuilt for them. That's really what we're designed to do, is not just give you a tip or a trick here, but help you go back to your practice and move your practice in the direction of doing the kind of dentistry you aspire to do.
Yep.
And in addition, how do you market yourself as that person? How do you help patients know that you offer that kind of dentistry? So it's a really fun program to be able to be part of.